Joel Topf with Nephrology Times. I'm here with Dr. Minnie Michael. She's at the Baylor School of Medicine and Texas Children's Hospital, and she is studying primary hyperoxaluria type 1 and has a phase 3 clinical trial that's presenting here today on Lumasiran.
Lumasiran.
And this is a microRNA interference, is that right?
Yes.
And
mRNA.
mRNA, and it acts in the
liver, and it blocks a enzyme which actually produces substrate for the oxalate. So basically, one step before the PH1 enzyme defect.
And that relieves the pressure, and these patients do well, it looks like. So I think there was like 18 patients enrolled in the trial, or was it 14?
Yes, 18 patients in this poster, that's children under 6 years of age.
And this is for children. And
it's a multinational study.
And how often do these patients get this medication?
So initially they get monthly for 3 months.
Yep.
And then depending on the weight, if it's less than 10 kilos, they get monthly injection. If they're over 10 kilos, every 3 months.
Every 3 months, once
and
they're
it's
over 10
subcutaneous,
kilos.
and they can take it at home.
And it's just a sub-Q, and they can do it at home. Oh, that's great. That's great. And so then I just got a sense, you're a site PI for this study. How many patients from your site were enrolled?
Just one. It's a multi-rare,
ultra-rare
condition.
I get the sense that it's a very rare disease, and so that's why I was like, okay, one. And did any site have more than one?
I think, as I said, it was a multinational study, so there's Europe and other centers there that may have more than one.
May have more, but
because it's more common.
Tough
it's
to
an
enroll
autosomal recessive condition, so places where they have more consanguinity, they would have more patients. So
right, okay, but that's not Texas. Okay, and so, this trial had already been completed for people that were over the age of 6. Is that right?
It's actually under the age of 6 and over the age of 6 with the maintained renal function. That's ILLUMINATE-A and B. Both are completed.
Everything, it's all completed. But the drug's not yet approved?
Yeah, it was approved in 2020.
It was approved forever ago.
Yeah.
But we're finally getting our data on the
final.
Yes. You have only one patient with PH1. I have 0 patients with PH1. I've never even seen the disease.
Yeah. Okay. My patient is now on the commercial medication.
Great. And I was just looking at the abstract. It looked like the drug was a tremendous success. Yeah. Like nobody had any progression of renal failure. Their kidneys GFR went up as you'd expect as they got older and bigger. Yeah. And stone risk was really, really low.
Yes, that's correct.
Are we done with this disease? Have we figured this out? Is this a cure? Or close enough?
There's more research going on.
What are the questions that are outstanding with PH1? You got a drug that seems to block the production of this early on, allows the kidneys to continue to grow. What are the outstanding questions that you're interested in?
I think if there is a permanent solution, like if the gene therapy or
gene therapy. And they're working on that.
Yeah.
Okay, excellent. And what other messages do you want to give about the PH1 and the Lumasiran? I think
early diagnosis is because from comparing different trials of different age group.
Yeah.
If you look at the GFR.
Yeah.
The ILLUMINATE-B, which included young children under 6, they had the better GFR than the older children in ILLUMINATE-A.
It's the same message that we always have. Get these diagnoses early, get them treated early, and they get better outcomes. Yeah. Excellent. And how do you make this diagnosis?
So anyone with any children with more than one, kidney stones, you should be doing. Now the genetic testing is easily available.
Yeah.
You can do that. Urine oxalate levels is the first step. But you can also concurrently do the genetic testing if you're suspecting that, especially if there's a family history. You don't have to wait for one to come back.
But with autosomal recessive, that family history probably is not that powerful, or?
There is, siblings,
siblings, sure.
Yeah.
Sure, if there's a big family. Okay. Excellent. Anything else? Any other final thoughts on Lumasiran and PH1?
Now if you treat early, if you pick up early, then you can avoid. The previously standard therapy was liver kidney transplant.
Yeah.
And liver transplant hopefully can be
curative.
avoided.
So
You don't
that's a
have
form
to
of
do it.
genetic therapy, right?
Yeah.
But-
No. Yeah.
The liver
So even
transplant-
with this one too, if your patient present late with a decreased GFR, you can still treat with the Lumasiran and get them stable.
Uh-huh.
And if they have advanced CKD, then you can do kidney only transplant.
Kidney only, because
Yeah.
you're not going to trash the new kidney
Yeah.
with the hyperoxaluria. So it eases up the surgical burden.
But they still have to remain on Lumasiran.
But they have to stay on the
for-
drug. Yeah, that's right. They're
indefinitely.
going to trash that kidney. Awesome. Hey, Dr. Michael, hey, thanks for joining us at Nephrology Times.
Yeah, thank you. Thank you for